Okay.
So you know, but you can start it.
Okay. Hi, I'm Dr. Michelle Stafford at World of Smiles, here for another edition of our Mixed Dentition podcast. And today, my special guest is Kasi Woidyla of Virginia Garcia Memorial Health Centers, and you are the Public Relations Officer of this wonderful organization.
I am.
So why don't we start by you tell me more about Virginia Garcia, and then we can talk about what you do there.
Okay. Well, Virginia Garcia is a community health center. We have 18 locations in Washington and Yamhill County. We serve about 48,000 people in the community. That's 1 in every 15 people call Virginia Garcia their medical home. Our patients are amazing. They speak more than 60 different languages. We have just a variety. We have a reputation as being primarily Latino. Mm-hmm. We are not. As you can tell with 62 languages, we cover a lot of ground. We have a lot of nationalities, a lot of countries are represented, and of course, all are welcome. Mm-hmm. So we love what we do, and it shows in each of our clinics. Mm-hmm. We've been around, I think I said this already, for 43 years.
Yes.
And it all started back in 1975 when a young girl by the name of Virginia Garcia was coming up from Texas with her family. They were making their way up through California, following the crops and farming. And they somewhere along the way in California, we believe she cut her foot. Mm-hmm. By the time she got to Oregon, it had become infected. And they went and sought medical care, mm-hmm. but it wasn't that she didn't receive care. It was that she didn't receive culturally appropriate care. Mm. So when the doctor saw her, her parents didn't speak English. So he or she was not able to communicate with them effectively. The medication they gave the family was most likely in English. Right. It more than likely was penicillin, which requires refrigeration, which they did not have access to. So there was a lot of things along the way. It wasn't that she didn't receive care, it was that she didn't receive the care she needed and that she could understand. And so as a result, she died. She was 7 years old. Right. And as a result of her death, the community really, really rallied and gathered around that family and around her and just said, things like this cannot happen again. Mm-hmm. It just can't be the norm for people to die because of simple things like a cut on the foot. Mm-hmm. So within 2 weeks, the founders found themselves sitting in the offices of the Providence Sisters, mm-hmm. and they worked out a deal, and within 3 months, the first Virginia Garcia Memorial Health Center opened. It was in a 3-car garage in Cornelius, and we were primarily focused on migrants and seasonal farm workers. Yes. But as they began to work, they began to see a greater need, a broader mm-hmm. need in the community. And so they began to see more. And it just grew. It just grew out of need. Right. And as a result of that, here we are, mm-hmm. 43 years later, 18 clinics. And really, we are the largest community health center in the state. Mm-hmm. We are federally qualified, and we pretty much accept anybody that wants to walk in our doors.
Yeah. It's a really wonderful organization.
It is. I love my job.
Pretty amazing. I bet. You have a great job.
I do. And it's easy.
So tell us more about exactly what you do, Kasi.
So I am the public relations officer. I'm responsible for not only media and PR, but also all marketing, mm-hmm. Branding, guidelines, strategy, that's what I was going to say. Strategy, and also events.
Yes.
So all of our fundraising events, we have 3 primary ones every year, and then we have small ones like this year. We're rolling out our new health mobile clinic.
Yes.
It's amazing.
I know. I can't wait to see it.
It's so awesome. And so we're doing a road show for that, so that has a few extra events around it. Last year, we opened up the Beaverton Wellness Center in Beaverton, mm-hmm. and so we had a couple extra events around that last year. But this year, the 3 primary ones are our healthcare symposium, mm-hmm. which is coming up really quick.
Yes.
May 13th.
May 13th.
Yeah, it is on vicarious trauma and trauma-informed care. The people who provide the care for people who have experienced trauma, mm-hmm. also need care. And it's important that we address for them how to care for yourself in these times so that you can be your best person for those that you're caring for.
That's great. And that's May 13th.
May 13th at OHSU on the waterfront. Tickets are on our website, virginiagarcia.org.
Yes.
The other event that we super love is the Grape Adventure.
Yes.
It's in July this year, July 20th. It is a fantastic event, wine tour, ending with a garden party and dinner at Rex Hill Winery.
And I can say that one is a very fun event. I go every year, usually try to bring some of my friends.
Yes.
And it's usually on a wonderful sunny day.
Yeah. Well, this year it's in July, so it's definitely going to be a sunny day.
Yeah.
But that's why we moved it to the evening. Right? It was, we wanted people to not sit and melt in the sun all day long. So, and that's why we moved it to a dinner. It's just a lot more relaxed and formal and informal and fun. So we really enjoyed that event.
And a great time to raise money for Virginia Garcia.
Yeah, it's a fun event, really fun. And then the one that I'm super excited about the most is at the end of the year, September 27th is Prospera.
Yes, that's a fun one too.
Yeah, and we will be at the Sentinel this year, so it'll be we're taking it up a notch. It's going to be a little bit more fun, a little more formal. We're going to have a lot of fun things going on, and it's going to culminate in this amazing event to raise money for the health center.
Great.
So,
Yeah.
So
Wonderful.
I'm pretty excited.
Well, I've been involved with Virginia Garcia for many years.
Yes.
We see a lot of kids
Yes.
from Virginia Garcia that are referred to us that have extensive dental needs. And I just love the organization. I think it's so important in our community to provide culturally competent health care to families, especially during certain times when maybe families have some fear around going to
The dentist.
dentist or even to the doctor for various reasons. And so being able to provide that care to these families is so important in our
Well,
community.
you are an amazing supporter, and I've only gotten to know you personally in the last year, but you are amazing. You and your husband, amazing people, and wonderful for the community. But we we love connections like yours. You've served on the board for a few years now.
Yes, I
and
have.
and critical and amazing work there too.
Wow,
So
I
thank
love
you
being
so
involved.
much.
Oh, thank you.
Yeah, thank you.
It's an incredible organization, and I feel lucky to be so involved with an
Yeah.
organization that provides care to so many people
Yeah.
who truly need it.
They do,
And you
they
truly
do.
feel like you're making a difference for these families.
Yeah, you do.
So
Yeah,
it's
all
very
you have to do is
powerful.
sit in a clinic for an hour and just look at the people that come in, and you know that this is where they need to be, where we can
Right.
take care of them. And so we love doing that. We love empowering people because when you're healthy,
Yes.
you are able to do more and to
Definitely.
be more. And we don't want healthcare holding people back from being the best selves. So
Definitely. I love it.
excellent.
Well, anything else you would like to share about Virginia Garcia, Casey?
Well, other than we're an amazing organization.
Yes.
No, it's we would encourage people to check us out on our brand new website.
Yes, and the website looks wonderful. I know you worked a lot
I did.
to make that website.
Well, and I'm super excited about all the information it brings forward.
Yes.
And all the it's focused on it's not only focused on the patients and providing them with the information they need, but also donors and folks looking for a job. We are always looking for people to join our organization who
Yes.
want a career that is focused on somebody other than themselves. So it's a really great organization to work for. So if you're I would always encourage people to take a look there. But I would encourage people to check out our website and see what Virginia Garcia is all about.
Wonderful. Well, thanks for being part of the podcast today, Casey. I appreciate it.
Thank you.
And if any of our listeners or viewers are interested in going to one of these events with me, please email me. You could be my guest. I will be there again. It's a lot of fun. We would love to bring you. And thank you again for being here. And
you.
everybody have a wonderful day and fill the world with smiles. Thanks. And freeze.
And freeze. And we are clear.